Nursing 431, Identifying Nursing Research Problems. The course learning outcomes for this week include develop a proposal for a project that will resolve a problem in a professional work area. Number 2, integrate knowledge from other disciplines when utilizing the nursing research process. And number 4, apply critical thinking when relating nursing research to practice. The weekly learning outcomes include identify the process of critiquing problem statements and research questions, identify the process of critiquing the literature review section of research articles, identify the process of critiquing the framework section of research articles, describe classifications of hypotheses, identify sources of nursing research problems, conduct a literature search on a specific topic, obtain references from scholarly resources, extract pertinent information from literature resources, and write a research question proposed for a proposed nursing study. A clearly identified and developed research problems gives direction to the study and helps the reader evaluate the research article. There are 4 very important sources for generating nursing research problems. They include personal experiences, literature sources, existing theories, and previous research. The research problem, it's a critical first step. It is often difficult for beginners, but it is an expectation of nursing students. And like I said, it gives direction to the study and helps the reader evaluate the research article. Factors to be considered when choosing the appropriate topic for a research study are important. One of the most important considerations in a study addresses the ethical component of the study. This includes ethical laws, professional organization, and institutional review boards. All nursing studies should have relevance to the practice of nursing. So significance to nursing questions you may pose: will clients benefit from the findings? Will healthcare professionals benefit from the findings? Will the findings add to our nursing body of knowledge? And can nurses use the results? In addition, the researcher must be very interested and intrigued by the research. A researcher that is interested in the topic, the study becomes a treasure hunt and results will be rewarding to the researcher. Research is conducted by nurses who have advanced educational degrees, but it should also be learned and encouraged at the undergraduate level. Researchers must consider the feasibility of a study's time frame, cost, equipment, supplies, support, and subject availability. So you can see that there's many factors that do go into research studies. The important criteria for writing a research question are that it is written in an interrogative sentence form, it includes the population, includes the variables, and is empirically testable. A research question should be written in interrogative sentence form that is clear, grammatically correct, and demands an answer. The research question must identify the main group of interest in the study. The research study should include all the variables. The research questions need to be empirically testable, containing variables that can be measured by the research. Research questions that examine more than one variable are usually written as correlation or comparative statements. Research questions need to be neutral or non-predictive when very little information is not or knowledge is known about the study. The process for writing problem statements is made easier when a specific format is used. Writing problem statements include correlation statement format, comparative descriptive format, and comparative experimental format, and substitute other variables for X and Y. The problem statement is usually presented at the beginning of the research article. The abstract often includes it and is usually at the end of the introductory section. There are certain questions that should be asked to evaluate problem statements. The questions used to evaluate problem statements include: is the research problem area clear? Is there a problem statement, purpose statement, or research question? Are the study variables and population included? Was the study quantitative or qualitative? Were empirical data gathered on the topic of interest? Was the study ethical? Is the feasibility of the study evident? And lastly, is the significance to nursing apparent?